overhaul Waynes be included in the record?
Without objection.
Well, I would say to my friend from Arizona, and with reference to the issue of the process, it's been a bit of a charade. In fact, a total charade. We've been out here for 2 weeks on the amendment process. We've had 21 votes, many of them side by sides, in order to cover the majority against potential downsides of voting to cut Medicare and voting to raise taxes, but no serious effort to engage in any kind of genuine amendment process such as the senator from Arizona and I've been involved in here for quite a while. So and then the bill that we're actually only allowed to have about 2 votes a day on is not the real bill. The real bill is, well, we know what the core of it is, but there are a lot of little things around the edges that are being slipped in and slipped out. And they want to jam the public before Christmas, as the senator from Arizona indicated. How arrogant is that? We know better than you. We know better than Republicans. We know better than the public. Why don't all of you all, the Republicans and the American public, just sit down and shut up and leave it to us, and we'll take care of it before Christmas?
To the Republican leader, the senator from Kentucky, I believe there's another little bit of history being made. This bill, this process is really historic in its arrogance. I mean, it isn't very hard to understand. I mean, the proposal is to take 16–17% of our economy, affect 300 million Americans. Nothing could be more personal, as the Kentucky senator has said, than our health care. And we don't have the bill. We do not have the bill. It's being written in secret in another room, and if there's any part of this debate that went through to every single household in America, I believe it was when the Finance Committee voted down a motion, the Democrats voted down a motion that the bill should be on the web for 72 hours so the American people could see the text, know what it costs, and know how it affects them. 8 Democratic senators then wrote the Democratic leader and said, we want to insist that we know what the text is, that we have the official score from the Congressional Budget Office, and that we have it for 72 hours before we move to vote. Now, we don't have the bill. We don't have the official score from the Congressional Budget Office. 72 hours is 3 more days. And even though 8 Democratic senators said we want to know what it costs, know what it is, and know how it affects us, they want to run it through before Christmas.
And maybe, could I just mention to my colleague, maybe the reason why they don't want it to be on the line for 72 hours is because when they examine what we have, on page 324 on this bill, an $8 billion tax on individuals that have non-government, quote, approved plans. Page 348, a $28 billion tax on businesses that cannot afford to offer insurance to their employees. On page 1979, raises an almost $150 billion tax on many middle-class workers called Cadillac health insurance plans. Page 1997 will cost families and individuals an additional $5 billion by prohibiting the use of savings set aside for health care expenses. Page 2010, make the cost of life-saving medicine more expensive by taxing pharmaceutical research firms, $22 billion. The list goes on, including page 2040, increasing Medicare payroll taxes by $53.8 billion. That's one reason why maybe it's going to be difficult for them to win passage of this after 72 hours of examining this 2,000-page bill.
Well, it obviously makes this bill, in addition to all of its other problems, a job killer. With unemployment at 10%, a big tax increase on a variety of different Americans, as Senator McCain just pointed out, in addition to all of its other problems, its substantive problems, its process problems, it's a job killer in the middle of a very difficult recession.
I'd say to my colleagues that the lack of transparency, one of the things my friend President Obama said he wanted to have was transparency. There's been no transparency in this process. And that's why at least transparency, if there's not going to be any transparency in the process, we ought to at least have it transparent to the American people for 72 hours. And then even the quote from the chairman of the Finance Committee is, I think it's impossible to certify that any senator will fully understand. So here we're going to have a 2,000-plus page bill, and the chairman of the Finance Committee says he thinks it's going to be impossible to certify that any senator will fully understand this bill. That's the best reason I know not to pass this bill. Because if we don't understand it, you can bet the American people aren't going to understand it.
But that seems to be the reason that the support of this is at an all-time low.
Enough Americans are that they don't want it. That's thanks to the efforts that have been made all over this country to educate the American people about what the impact of this bill would be.
Well, just as following along what you're saying, that's why the support right now of the American people for this bill is at an all-time low, the lowest level of support ever. Fewer, this is the new NBC poll out just yesterday, fewer than 1 out of 3 Americans support this bill. They don't know what's in it, but they sure don't like what they see so far, because they all believe, overwhelming numbers believe, that their own cost of their own care will go up, that this will add to the deficit, it will hurt the economy, and that their health care would actually be better if we pass nothing. So why would the American people support a bill that's actually going to cost them more personally, and their health care is going to get worse? That's not the value the American people have ever wanted. So, you know, that's what I hear from my patients at home. That's what I hear on telephone town hall meetings. That's what I hear when visitors Wyoming. But that's what we're hearing in all of our states. And that's what the American people continue to say: do not pass this bill. As our leader said, we do need health care reform, and Dr. Coburn certainly knows that, but it's not this reform that we need.
We come to the floor every day and point out the problems with the bill. We've done that today. One, we don't have a bill, can't read it, don't know how much it costs, don't know how much it affects the American people. We point out that it raises taxes, it raises premiums, it'll increase the debt because it doesn't include a lot of things like the physician's reimbursement, and it cuts Medicare by $1 trillion over 10 years once it's fully implemented. But we also point out what we think should be done. And what we think should be done, and the colleagues here have talked about it many times, is instead of wheeling in another 2,000-page bill, we should focus on the goal of reducing cost and then take several steps toward reducing cost. And the senator from Arizona has talked about one of those, which is reducing the number of junk lawsuits against doctors. But I don't think that's anywhere in the bill unless it's secretly being added in the back room today.
That's one I doubt is being added. But again, I also want to point out Americans are now against passage of this legislation, but in that polling data, it's very interesting also, too, the majority of seniors by much larger numbers, the actual beneficiaries of Medicare, are turning against it, and the intensity of Americans against it, which is harder to gauge in a poll, is incredible. If the responses that our efforts are getting are anything indicative of the mood of the American people and the intensity of it, it is probably as great as I have ever seen in the years that I have had the privilege of serving in the Congress of the United States. And this polling data, it says more Americans now believe it's better to keep the current health system than to pass President Obama's plan, is the message that's being sent, and the intensity of it is higher than any that I have ever observed in my years of service, and I thank them for it, because there's a chance that we could stop this, start